Michael Johns thinks of himself as part of the sandwich generation, crunching the numbers to care for kids and ageing parents, along with rates on a unit while his family's new home is being built.
Either use public transport or ride our bicycles around as opposed to running the car. We limit discretionary spending. We try to keep control of discretionary spending. Renter Ellie Kadushin is facing different challenges. She works 1 day a week and receives a disability support pension and is eligible for a rebate on her energy bills.
It takes a bit of the edge off bills and stuff like that.
While the ACT government says there are still subsidies and services people like Ellie can call on, others, like Michael, will have to wear some of the burden of repairing a budget strained by growing demand for health services.
We have had to make difficult decisions in the budget to be able to continue to deliver the critical healthcare services that Canberrans rely on.
The deficit for this financial year has blown out beyond $1 billion, but the government expects to more than halve it in just 12 months, before eventually returning surpluses a year later than previously expected. As for net debt, it'll continue to grow through the forward estimates.
We need to make sure that we continue to look at the infrastructure program and make sure that it's deliverable. We're not going to be cancelling infrastructure projects that the community expects us to deliver.
Instead, the budget includes a new annual $250 health levy for the next 4 years on residential, commercial and rural rates.
The choice that we had in this budget was to continue to deliver those critical healthcare services or to stop the delivery or slash or cut the level of support that we could provide in our hospital system.
There'll also be an additional tax in general rates on residential non-unit properties with an unimproved value of more than $1 million. And there'll be increases in the existing ambulance and Safer Families levies, adding $290 in total to Ratepayers' bills, on top of annual rate increases of anywhere between $47 and $2,332 for standalone homes and between $25 and $334 for units, depending on the suburb.
We expect that interest rates will continue to come down through the budget, and so that will ease cost of living pressures, we think, for households.
Along with the inevitable increases to things like parking, vehicle registration and public transport fees, the duty exemption for purchases of zero-emissions vehicles will end. And for businesses, the wage bill threshold for liability for payroll tax will be reduced from $2 million to $1.75 million. The government insists it'll be doing some belt tightening of its own, looking for $282 million over 4 years in savings in the Territory Public Service.
What we are seeking to do is restrain the growth in full-time equivalent public servants, but not make cuts, and certainly not affecting public servants' pay.
The Treasurer says underestimates of Canberra's population by the Australian Bureau of Statistics, skewed by the use of Medicare addresses, is an ongoing issue affecting the ACT's share of GST, and he argues the Commonwealth should be chipping in more for the health system.
Should be 45%, could go as low as 33% unless they contribute more into the system, and so that will be the subject of quite intense negotiations.
We know the government has a spending problem, so there was only one way this was ever going to work. You either increase your income through tax or you drop your spending.
Those relying on government subsidies say they have to keep up with inflation.
So not just it goes up once and then they kind of leave it there, because everything else goes up as well.
Michael appreciates the rates-funded services that are available, but the prospect of an increase presents challenges.
Every time you pay the rates, I mean, that's less money to pay at the supermarket.
Keeping sandwiches on the menu. Harry Frost, ABC News, Canberra.